These are the lecture notes for Chapter 12 on the heart. We're going to focus on the heart anatomy and the pathway of blood flow through the heart. But here's a little bit of information about the heart, just some facts. The heart beats about 100,000 times a day and pumps about 8,000 liters of blood per day through the blood vessels that are connected to the heart and the cardiovascular system. And if you think about that, 8,000 liters of blood, that is, think about a 2-liter drink. Okay, so how many 2-liter drinks is that? That's going to be like, 4,000? Is that right? Yeah. 4,000 2-liter drinks. It's hard to even imagine. So it's just kind of an unimaginable number. But the blood flow from the heart into blood vessels and back to the heart is divided into 2 circuits. The pulmonary circuit carries blood from the heart to the lungs, and then from the lungs back to the heart. And the systemic circuit carries blood from the heart to the rest of the body, and then from the rest of the body back to the heart. There are 4 muscular heart chambers to pump the blood, to receive the blood. They're called the left and right atrium, and then to pump the blood, they're called the left and right ventricles. This is an illustration that shows the position of the heart in the thoracic cavity, in the chest cavity. And you can see that it's located between the 2 lungs. The heart lies within the mediastinum, which is, it lies within the pericardial cavity, which is in the mediastinum. And that is the area between the 2 pleural cavities, which are the cavities that hold the lungs. So, and the heart is behind the sternum or the breastbone. But this is how it's positioned between the left and right lung. You can see the apex of the heart here. It's kind of like the tip of the cone, and then the base of the heart is the superior end. The apex is the inferior end, and it's going to be more toward the left side of the body. It's turned that way. So as far as the serous membrane that surrounds the heart and protects it, it's called the pericardium. Remember, there were 3 serous membranes that we learned: pericardium, the pleura, and the peritoneum. So the one that surrounds the heart is called the pericardium. And if we look at this illustration of the fist punching into a balloon, you can understand the 2 layers of the serous membranes. There is a visceral layer that contacts the fist when you punch it into the balloon. And then you have the layer that doesn't actually contact the fist, and it's called the parietal layer. In between those 2 layers that are formed from punching the fist into the balloon, you have air. Okay, so if we use that analogy, come back over to the heart, the visceral pericardium lines the heart. Visceral pericardium lines the heart. And it is also called the epicardium. It's the portion of the heart wall that covers the heart. So it's the outer layer of the heart wall. Then you have the space in between contains pericardial fluid, which is serous fluid. And the layer outside is called the parietal pericardium. All right, so this is some surface anatomy of the heart. I'm going to go over every one of these structures, but this is an anterior view of the heart. This would be like if you were looking down into someone's chest. You would see more of the right side of the heart. You would actually view more of the right side because the left side is kind of, some of those structures are in the back. So we've got the right atrium, the right ventricle, and then this little depression in here that contains fat and blood vessels, and it's called the coronary sulcus. Then we have the left atrium, a little portion of it, the left ventricle, and in between the 2 ventricles, we have the interventricular sulcus. also contains some fat and blood vessels. For the major arteries and veins, the major arteries are the aorta, which is divided into the ascending aorta, then the aortic arch, and the descending aorta. The branches from the aortic arch are the brachiocephalic trunk on the right side. Then you have the left common carotid artery in the middle and the left subclavian artery on the left side. There is a little tiny ligament that connects the aorta to the pulmonary trunk. It's called the ligamentum arteriosum. The pulmonary trunk is the major artery that takes blood to the lungs, and it splits into the left and right pulmonary arteries. So the aorta carries blood from the heart to the systemic circuit, and the pulmonary trunk carries blood to the lungs. Now, the veins that bring blood back to the heart are called pulmonary veins, and you can't see them in this view. If they bring it back to the heart from the lungs, they're called pulmonary veins. But also the vena cava, and you can only see one of the vena cava. It's called the superior vena cava, but there's also an inferior vena cava. So let's look over here at the posterior surface of the heart, where you can see the left ventricle a lot better, and you can see that it's much bigger, much larger and thicker than the right ventricle. So we have the left ventricle, the left atrium. You can see the coronary sulcus in here. And you can see this area called the coronary sinus. This is where blood from the coronary circulation, these are the blood vessels that supply the actual heart. The blood drains from those blood vessels into the coronary sinus and enters the right atrium. Blood from the upper body comes in from the superior vena cava to the right atrium, and blood from the lower body comes in from the inferior vena cava into the right atrium. So you have three pathways draining blood into the right atrium, both of the vena cava and then the coronary sinus. Okay, so we can also see a little bit of the aorta. We can see the pulmonary arteries, which branch from the pulmonary trunk, and we can definitely see very clearly the left and right pulmonary veins. And we can see our right atrium and our right ventricle. The heart wall, if you were to take and cut into the heart muscle tissue, you would cut through the outer portion of the heart wall, and then the middle, and then the inner, the lining of the heart, the inside of the heart. So you're going to see the parietal layer of the serous pericardium, the parietal pericardium right here. And then you're going to see the visceral pericardium, which is actually the epicardium, and that will be the outer portion of the heart wall. And it's composed of epithelial tissue and areolar tissue. Then you have the myocardium, which is primarily cardiac muscle tissue. And then you have the endocardium, which is the lining of the inside of the heart, and that's composed of simple squamous epithelial tissue and areolar tissue. Okay, so, and that's in these notes as well. Now we're going to skip to this structure. This structure is important for helping you to see how the blood flows through the heart, so the pathway of blood flow through the heart. We're going to go through that pathway using this structure as a guide, and then we're going to actually type out the pathway on another slide, on the next slide. We're going to go through and just type out the pathway, naming the chambers of the heart and the major blood vessels and the valves. So there's going to be 4 chambers. That's going to be right and left atrium, right and left ventricle. There are 4 major blood vessels, and that's going to be the aorta, the pulmonary trunk, the pulmonary veins, and the vena cava. And there are going to be 4 valves, and that will be the tricuspid valve, the bicuspid valve, the pulmonary valve, and then this little piece of the aortic valve. So 12 total structures in our pathway. All right, so oxygen poor blood, starting in the right atrium, oxygen poor blood is going to flow through the tricuspid valve into the right ventricle. Right atrium, tricuspid valve, right ventricle. Right ventricle is going to pump the blood through the pulmonary valve, pulmonary trunk, pulmonary arteries to the lungs. And then it's going to pick up oxygen and come back to the heart through the pulmonary veins into the left atrium. Next, the blood is going to move through the bicuspid or mitral valve into the left ventricle. Left ventricle is going to pump the blood past the aortic valve into the aorta. And then the aorta is going to take the blood to the systemic circuit, which is basically all the cells of the body that don't include the lungs. It's going to deliver oxygen to the systemic circuit and come back to the heart as oxygen poor blood or deoxygenated blood. And it will come back through the inferior and superior vena cava back into the right atrium. So a few other structures that we can see this little depression in the right atrium called the fossa ovalis, and we'll talk about that more. And we can see that attached to the tricuspid and bicuspid valves, we have these, sometimes they're called heartstrings, but in anatomy we call them chordae tendineae, and the chordae tendineae are attached to papillary muscles. And then we see these little branching structures called trabeculae carneae. Your divider between the atria is called the interatrial septum. And you can see it kind of right there. And then the divider between the ventricles is called the interventricular septum. And I'm pretty sure I've covered everything now. So, all right.